Colorado Public News sat down with members of the House of Representatives from Colorado to determine how they're voting on repeal of the health care bill and what provisions are causing them to vote yes or no.
You know, I'm going to vote to repeal the health care, but we can't stop there. It's also going to be replacing it with some common sense proposals that go back to what the original concept in healthcare reform was about. That was affordability and accessibility, which was not addressed by this current legislation. In fact, the more we look at it, the more we find that it is a job-killing, tax-increasing, bureaucracy-building behemoth that we simply can't afford. In fact, looking into it, I've heard estimates that it's going to take 24 to 28 new agencies to be able to administer this health care bill. Why would I vote against it? Simply because when we look at the practical applications of this, it's going to be hurtful to the American people. It's getting doctors and their patient relationships inhibited by the federal government. When we look at the 1099s that are going to be required by every business for a purchase over $600, another layer of administrative costs which we simply aren't going to be able to afford. When we look at some of the provisions that, as an example, we now have the requirement that you, or at least you have the opportunity to be able to keep a child on your health care bill until they're 26. We don't make that same extension to our military personnel. What sense does that make? The more we examine this bill, and I think former Speaker Pelosi, now Leader Pelosi, had it exactly right. Once the bill was passed, we'd find out what's in it, and we find out that it's unpalatable. We can do it smarter, we can do it better, we can do it in a more cost-effective way. We're going to require Americans to be able to make a purchase. You know, the last I checked, we had the freedom of choice in this country to be able to make those determinations because government was going to set the perimeters by which you were going to have to make that purchase. That's probably one of the most offensive. When we look into it further, we find out that there's going to be an assessment on home sales after 2014. As one of the funding provisions that are in it. And one of the big reasons is what it doesn't include. How did it increase accessibility primarily for rural areas like I represent? We haven't seen any new doctors coming on. Thirdly, you know, we can look and see at the costs associated with health care. We're hearing case after case where health care premiums after the passage of this bill are going up in double digits. Senior citizens are being dropped from health care programs. People are finding out that it is not more affordable but less affordable for them to be able to provide for their health care needs. Let's empower private sector solutions. Let's allow us to be able to buy across state lines. Let's incentivize private medical health care savings accounts to empower people to be able to make their own health care choices. Let's talk about tort reform, which was not even discussed as this bill moved through the House of the 111th Congress. These are all provisions that are just common sense that we need to revisit and do it right. There's a provision in the bill that all businesses are going to have to fill out a 1099 for every purchase that is made over $600. As an example, a TV station goes down and makes a purchase for paper to be able just to put out reports and interoffice memos, and they exceed $600. They're going to have to issue out a 1099 to the companies that they made those purchases from. You know, if a farmer goes out and buys better than $600 worth of fertilizer, the farmer who's just trying to grow crops is now going to have to issue a 1099 back to the farm supply company because they made this purchase over $600. This is another unnecessary layer of bureaucracy, and I think a reasonable person would ask, why was this even included? But it's in the bill. It's just being uncovered, and there's more to be uncovered. When we're looking at some of the costs that are going to be associated after 2014, apparently purchases, sales of homes over $250,000, there'll be a sales tax, if you will, to where a portion of that sale, I think it's 3.25%, is going to be taken to be able to help pay for the health care bill. Well, we've got senior citizens that may want to be able to relocate, maybe to be able to sell that home and move to smaller accommodations. Are they going to have to pay additional fees, additional costs? These are not well thought out. Every one of us has a heart for people that are uninsurable, for our children as well. These are provisions that we can certainly look at and will be looked at after the vote to repeal this and bring in common sense solutions. The one thing that wasn't brought into this healthcare debate is what are the administrative costs going to be? What are the regulatory costs going to be once we get these bureaucracies in place and they start making the choices out of Washington, D.C. for home health care back in Colorado? That's not a sensible approach to making sure, if the goal is to provide good health care for our people in this country, there are going to be better approaches. We can address issues like children who are not being covered and those who have pre-existing conditions, but we can do those in isolation rather than establishing a gargantuan federal bureaucracy that, when you look at a $14.3 trillion debt in this country, we simply cannot afford.